Thank you, Mr. Speaker. To the Minister of Health, does he stand by all of his statements on health services?
The Honourable Tony Ryle.
Mr. Speaker, yes, including the statement that Waitemata DHB is improving frontline services for patients in their area. For example, last year, an extra 1,045 patients received elective surgery compared to 2008, an increase of 8%, and almost 2,000 extra patients got an appointment to see a surgical specialist, an increase of 10%. We're certainly delivering more for people in that area.
Dr. Paul Hutchinson.
Thank you, Mr. Speaker. To the Minister of Health, what further reports has he received of improved frontline services being delivered at Waitemata DHB?
Honourable Tony Ryle.
Mr. Speaker, I can advise the House that the $1.7 million refurbishment of Waitakere Hospital's Emergency Care Centre is now underway, which will bring full 24/7 emergency care services a step closer for the 220,000 people of West Auckland. When Minister and local MP Paula Bennett and I visited the hospital recently, we saw the site of an expansion in paediatric beds at that hospital, and I can advise that this weekend work will start on providing an additional 7 short-stay paediatric beds at Waitakere Hospital. Over the whole DHB, Mr. Speaker, general surgery is up 10% and ear, nose and throat is up 14% by way of example.
The Honourable Ruth Dyson.
How will his statements help the people of Tararua who are facing big health cuts, where a cancer support worker is reported as saying, "This is just the start. Already we're facing more calls for our services as funding cuts hit our area," and where health professionals say that the cuts to rehabilitation services and the axing of night coverage by the District Nursing Service will put even more strain on families, on carers and on volunteers.
The Honourable Tony Ryle.
Mr. Speaker, with respect to the night services being discussed by the member, there are going to be alternative services available for the people there. The people of the Mid-Central District Health Board have had additional fundings, like what? The $300,000 extra given to the local hospice.
Dr. Paul Hutchinson.
Thank you, Mr. Speaker. To the Minister, what other services are being improved at Waitemata?
The Honourable Tony Ryle.
Mr. Speaker, I'm advised that a new renal service is being put in place at Waitemata DHB. Presently, around 220 patients are on dialysis, and they are treated in central Auckland, meaning Waitemata patients must travel long distances 3 or 4 times a week for 4 to 6 hour dialysis sessions. To start next year, this new service will see existing patients transferred to Waitemata and all new patients treated locally.
Fantastic.
At North Shore Hospital, a new medical ward will open next month and a new chronic pain service will be starting very shortly.
The Honourable Ruth Dyson.
Supplementary. Why does he continue his parallel reality that there are no cuts, when every day I am alerted to new health cuts around New Zealand, which will get even worse?
I apologise to the member. Look, forgive me, but I just cannot hear the member's question. The House has been particularly noisy today. Now, I don't mind noise where the issues are very strongly held, but this is a member just asking a question. The Honourable Ruth Dyson.
Why does he continue his parallel reality that there are no cuts, when every day I am alerted to new health cuts from around New Zealand, which will get even worse when his much-lauded $536 million of new money will be dramatically reduced in the 2010 budget?
The Honourable Tony Ryle.
Mr. Speaker, what this government is able to show is that we are delivering more frontline services for New Zealand than that government was ever able to do. What we've seen today is certainly that the Waitemata District Health Board is providing much more services for people in that community.
The point of order, the Honourable Ruth Dyson.
I seek leave to table the Midlands Region newsletter of the New Zealand Nurses Organisation from the last quarter of last year, which quotes David Bennett and Tim McIndoe, saying New Zealand is now a second world country and as such we can only expect second world care and health facilities.
Leave us, table that document. Is there any objection? Order. Order. Now, members know when a point of order is being considered, they must be silent. How am I meant to hear where there's any objection to the leave being sought when there's so much noise? If members make that kind of interjection, I may in fact draw the wrong conclusion. Now, leave is sought for that document to be tabled. Is there any objection? There is objection. Question number 7. Question number 7, the Honourable Trevor Mallett.
My question